and de-imperialization that we want to see in the world, because everything that survives on the strength of the number of people who actually have the mental foundation to support that kind of system.
Wow, what an amazing journey we've been on here at XR Now, Extinction Rebellion Radio, and we are just getting started. But we cannot do this without you. Like everyone else at this station, this amazingly unique station, we create these shows for you without pay, on a purely volunteer basis, because we believe in the importance of having these voices on the airwaves and giving you a chance to listen to them. So please, if you're not already a sustaining member of the station and you have the ability to do so, or to support KPFK in any amount, please go to kpfk.org right now and hit the donate button. Thank you. XR Now is produced by Todd Katzberg and myself. Our theme music is by Moby. Check out xrla.org for more, including when you can sign up for our next online crash course with Kate Swigert, or attend our next XRLA Community Potluck. This very weekend, Sunday, we are co-hosting the Los Angeles Rising Picnic with Los Angeles for All and the 8th Los Angeles Anarchist Book Fair. Should be a lot of fun. As always, we welcome comments and questions about XR Now at xrnowkpfk@gmail.com. I'm your host, Stephen Starr. Thanks for listening to XR Now, Extinction Rebellion Radio. We are nature defending itself.
Pundits are procrastinating about the presidential election in 2024, but there's an election process underway right now here at KPFK, the election for delegates to the local station board. 28 candidates are running for 9 open seats to represent you, the listeners, in the governance of the station and the Pacifica Foundation. We have been and will continue airing brief candidate statements. The week of August 14th, we will be running live on-air candidate forums with small groups of candidates, with a chance for you to call in with your questions so you can be well informed about the issues and positions they are addressing. Ballots will be going out to listener members starting August 15th, so please tune in Monday through Friday, August 14th through the 18th from 2 to 3 p.m. in English, and Monday through Thursday, August 14th through the 17th from 8:30 to 10:30 p.m. in Spanish, with translation for candidates who need it. Ballots with your single transferable vote preferences are due by the 30th of September. 10% of the listener membership must vote to achieve a quorum. So be sure to listen in Monday, August 14th through Friday, August 18th at 2 p.m., taking your calls after brief candidate statements in English, and Monday, August 14th through Thursday, August 17th from 8:30 to 10:30 p.m. in Spanish. Thank you for supporting KPFK.
I love it too. Single payer healthcare is coming through. I said I like it. I love it too. 'Cause we're all covered. Yes, me.
Welcome to the Healthcare for Us show, broadcasting live from the KPFK studios in Hollywood, situated on stolen indigenous land. I'm your host, Erica Ferriston, part of the Single Payer Supremes trio, along with Maureen Cruz, a retired registered nurse from the LA County Department of Public Health, and Gina Viola, former mayoral candidate and local business owner. Together, we serve on the board of Healthcare for Us, an all-volunteer nonprofit organization committed to achieving single-payer healthcare in California and leading the larger fight for healthcare justice. The purpose of our show is to expose the costly and deadly design of the for-profit health insurance system, demonstrate the cost and life-saving benefits of a single-payer healthcare system, inoculate against medical industrial complex propaganda, and motivate our listeners to join the fight for the California single-payer bill, CalCare. We are in Fund Drive. We'll talk about that more a little bit later. So sit back, tune in, and let's get started.
Here on Healthcare for Us, we will always define what we mean when we say single-payer healthcare and CalCare specifically. As is our usual format, we will break down some news for you, a comedy clip to relieve some of the tension, and a song because there is no life without music. We are thrilled to have an in-house guest with us tonight, Taiji Miyagawa of API for CalCare. Woo-woo! Much of tonight's show will be us interviewing him, in between reminders that, yes, we are in Fund Drive.
And so we all understand what page we're on. We need to know the difference between something called a multi-payer system and a single-payer system. What we have now in the U.S. is a multi-payer health insurance system that involves hundreds of insurance companies and other intermediaries like HMOs with thousands of different plans. They collect premiums, they determine deductibles, they charge copays, and they collect the employer contributions and the government subsidies paid for with our taxes. Intermediaries are very expensive. They extract money away from our care for profit for CEOs' salaries of multi-millions of dollars, and they use our money for hiring people to keep track of all these plans and payments. These intermediaries not only collect our money, but they decide what we pay and what services that we can access. Worse than that, they decide what health care we can and cannot have. Any of our money not spent on our care is kept for their profit and to fund all of this wasteful bureaucracy. They are a business. Intermediaries are a business, charging as much as possible, giving us as little as possible, squeezing providers, and using networks to control access to the care that we need. So this multi-payer is a complicated, fragmented, inefficient, expensive, inequitable, irrational, and it is harmful to us all. Insurance and medical profiteering businesses exercise the power to delay and to deny our care and to push people into debt and bankruptcy for profit. Hospitals and clinics and other services, especially in lower-income communities, are forced to close departments like the emergency room, like labor and delivery, like critical care. Okay, and even shut down completely. We have lost 100 hospitals in the state of California in the last 15 years.
Shame.
It is. So intermediaries, like insurance companies, extracting profits, are destroying our health system. But we support a single-payer system. Single payer, I think, to me, the primary feature of single payer is it removes the insurance industry from the system.
Bye-bye.
It removes HMOs and any other intermediaries extracting money away from the delivery of our care, removes them from the system. There is no profit extraction in single payer. We pay the government directly into with a pool of all California residents with progressive taxation. The government then directly pays the bills from this public trust fund. Individuals do not pay the bills and do not pay out of pocket. The public trust fund pays the bills, but private providers still deliver our health care. There are no networks in the single payer that we are advancing, CalCare, right? Patients have the freedom to choose their doctors and their hospitals. All medical decisions are between a patient and a doctor. There's no hijacking of your doctor's experience and professional judgment by some business plan. Single payer is the fairest and the most rational way to guarantee that all of our payments of our money, right, go exclusively to our care.
Thank you, Maureen. And that brings us to what is CalCare? Well, CalCare is the name of the California single-payer bill proposed by the California Nurses Association. And as Maureen stated, because it's a single-payer bill, it would guarantee comprehensive, high-quality health care for every California resident. Does not matter your income level, does not matter your employment status, does not matter race, gender identification, immigration status. If you are a human being living in California, you get high quality, comprehensive care from the time you're born to the time you pass on. So this is what CalCare is. And we spent, I think it was the first 7 shows really breaking down CalCare, the 7 principles. So invite you to go to our website, HC4US.org, if you want to listen to those past shows. And then, of course, we have much you can read on the website, too, about CalCare. So, yeah.
Singapore is saying that if you don't take the COVID vaccine, you have to pay for your COVID treatment, which is a huge deal in Singapore because Singapore essentially has universal healthcare. So for them to come out and say, you're going to pay for your own stuff, if you don't take the COVID vaccine, we're going to treat you like an American. That's huge.
That's a punishment in Singapore?
In Singapore, being treated like an American in the healthcare system is the biggest punishment you could give someone. So you're going to have to worry about your co-pays. You're going to have to look at your disbursements. You have to call Blue Cross, Blue Shield. You have to find someone in network.
So that is comedian and actor Ronnie Chang. He's one of my husband and I. We love him. You can find Ronnie Chang's material everywhere. So I picked that clip, and we're still going to do a comedy clip, and that, of course, is funny, but also very real. And just, yeah, in Singapore, the greatest punishment you can have is being treated like an American.
Is American healthcare.
American
healthcare is a horror story.
It is multi-payer, and we want what Singapore has. We want single payer.
Right. It was interesting to hear him say at the clip, you're going to have your co-pays and this and that, when they don't have that in Singapore. So I wonder how they orchestrate those penalties for folks who didn't get vaccinated.
I don't know, but there's a single-payer health care for us, please.
And they're not the only country who says, please, we don't want to be like Americans. I had many French friends say, oh, we could probably work a couple more years, but we don't want to turn into the Americans. That's where we're headed. The world is now benching us as what they don't want to be.
Absolutely.
Because we don't take care of our people.
No.
That's at the bottom line of it. So.
I remember actually, Maureen, one of the first times I heard you talked about how you were in Spain visiting and how you ended up, in a clinic. You were sick and you went to pay, and the woman said, oh, you must be an American.
Right.
And she said, here in Spain, you're a human being.
Exactly. I said, I'm a tourist. I said, I'm a tourist. I'm sure there must be a little copay, as there is in some countries, like, $20 for your broken arm in Netherlands or something. And I said, I'm a tourist. And she actually shook her head. And she smiled at me and said, oh, you must be an American.
How about Michael Moore's movie when he's trying to pay and they finally send him downstairs and what they do is refund his parking? They think that's not only did he not have a bill, he got paid back for his parking. So
that's pretty funny.
Yeah. So anyway, I just wanted to throw that clip in there as COVID is on the rise.
Yes, it is.
And, Singapore has handled the pandemic beautifully, and they have a true single-payer system there.
As has Taiwan, and as has most countries, except for America.
Well, except for countries that don't have single-payer health care. So, Brazil, the United States. I forget the third one right now, but I think there's 3 first-world countries that are not doing well. So in other news, there's an article in The Guardian speaking of racism. It's at the heart of the U.S. failure to tackle deadly heat waves. Jeff Goodell, an award-winning climate journalist, told The Guardian that people of color, including millions of migrant workers who are bearing the brunt of record-breaking temperatures as farmhands, builders, and delivery workers, are not guaranteed life-saving measures like water and shade breaks because they are considered expendable. To be blunt about it, the people most impacted by heat are not the kind of voting demographic that gets any politician nervous. This is just shameful. They're unsheltered people, poor people, agricultural and construction workers. They're not seen as humans who need to be protected. Racism is absolutely central to the government's failure to protect vulnerable people. Heat, much like the COVID pandemic, exposes and exacerbates existing structural and racial inequalities in housing, wages, healthcare, there it is, mobility, and access to solutions. One of Goodell's biggest fears is that the world will adapt to heat deaths, much like it did with COVID. And, I don't think we did that any place else more than we did it here. I hear people saying to me now, well, COVID's just a cold. Even though folks are still dying hand over fist. Long COVID is really messing with people now in a really significant way. And guess what? That's not going to be covered under insurance because even insurance companies aren't taking it seriously and considering it and a condition that needs to be treated.
I appreciate that reminder out there. How, dangerous COVID is. One of the things that struck out to me in this article was he writes about high mortality rates among Black people have less to do with genetics than with the country's long history of discrimination, which has undermined education, housing, and job opportunities for generations of Black people, said Clyde Yancey, an author of the study and chief of cardiology at Northwestern University's Feinberg School of Medicine. And I think that's a really important point in this article because it shows that the harms done way back in the past, we often hear that, well, that happened a long time ago and that doesn't happen now, continue to exist and become amplified in the present. Yep. It's true for economics, and clearly it's true for education, and it's true for healthcare.
And we see that all the time in the police brutality against African Americans, in particular against our Black brothers and sisters. I found it very interesting that for the first time in the history of Mississippi, 6 cops are actually going to go to jail, and some for life, for brutalizing 2 Black men in Mississippi. And we know that this has happened many, many times. As a matter of fact, this group called the Goon Squad has been doing this for, over a decade. And there have been many complaints about them. Nothing has ever happened. And for this to be the first time tells us that, we haven't recovered from anything really. And we live in a caste system where we are able to regard some lives as more valuable than others and some people as less than human and less deserving. We even hear that when we talk about single-payer healthcare. They say, oh, but not those undocumented. Oh, but not those homeless people on the street. They're all drug addicts. This kind of talk. We've been, and I think it's capitalism has coached people and educated people to thinking you are what your bank account is. And we need to get out of that and get back to humanity and decency. Humanity and just plain decency towards one another. And that comes with justice and equality like a single-payer system.
Well said, Maureen. The next article I'm bringing just brings out more disparities, talking about how COVID-19 hit Pacific Islanders harder than any other group. This is an older article, but still prevalent because COVID is still raging, right? So back in September of 2021, the USC Center for Health Journalism's findings were more than a year into the pandemic. The virus is continuing to hit the region's Native Hawaiians and Pacific Islanders especially hard. And when you dig into it, you can see the data of the numbers, the disproportionate numbers of folks, especially in Long Beach and the southern parts of our county, affected these groups. And it's not surprising when you hear the statistics I was sent today. Approximately 14% of Asian Americans and 15% of Native Hawaiian people in California do not have health insurance.
So
a
I'm
rate higher than whites.
going to have to interrupt this news bit for a station ID, and then let's get right back to it. So you are listening to 90.7 FM KPFK, the voice of the people, a platform for communities often silenced by mainstream media. KPFK reports on vital issues like single-payer health care, Black liberation, abolition, the needs of our unhoused neighbors, and all racial, social, environmental, and economic justice issues that, mainstream media just won't even touch. So your support is crucial in keeping this people-powered radio station alive. So please give us a call to donate at 818-985-5735. Press the number 2 or go to kpfk.org and click donate. By donating today, you become part of the KPFK team, part of the KPFK family, driving this activist community forward. Together, we fight for change in the streets and sound the rallying cry on our shows. Your contribution matters, big or small. So join the cause and support us with whatever you can afford. Go ahead and go to kpfk.org or give us a call right now at 818-985-5735. Press the number 2. And when you make your pledge, let them know how much you appreciate our show, Healthcare for Us. We would so love that. And one of the best ways you can really support this station is by becoming a monthly sustainer. Imagine the impact we could make together. If you've never donated before, now is the perfect time to make that first-time pledge, whether it's $100, $50, $10. If you can make it monthly, even $5 a month would make a difference. So give us a call at 818-985-5735 or hit us up at kpfk.org. And thank you so much for all your support.
Okay, I think we're going to break for a comedy clip.
My mom had to raise us on her own. She did on her own, tough as shit. Sometimes a little too tough. Like it was borderline illegal, but she never took us to the doctor. My mom never took us to the doctor. My mom raised us like we were still in the Philippines. She tried to cure everything at home, like a real Filipino woman. You had to die to go to the hospital. My mom cured everything with Vicks VapoRub. Vicks VapoRub. I should have died 9 times when I was a kid. That's abuse. There's one time I thought I had pneumonia. I go, Mom, I think I have pneumonia. She goes, I'll put extra Vicks on your body, Joseph. Just rub it everywhere, Joseph. Rub it on the bottom of the foot. And then put a sock on the foot, and then the pneumonia will come out of the foot, Joseph. I just smothered it in Vicks.
Again, okay, so that was Joe Coy on his Live from Seattle tour. Just a little bit about Joe Coy. He began performing at Las Vegas coffee houses and now sells out arenas across the world. And
he's funny.
Because he's hilarious. And I love this fun fact, so I wanted to include it. In 2017, Coy broke a record for the most tickets sold by a single artist at 23,000 tickets and 11 sold out shows at the Neil S. Blaisdell Concert Hall in Honolulu. And in response, the mayor's office in Honolulu proclaimed November 24th as Joe Coy Day. So
I love that. And I love that every mother has her remedy. Mine is Aquaphor. Anytime that the kids, they're itching, something hurts them, I'll go put some Aquaphor on it. It's been like magic.
Well, this is a generational thing because mine was Vicks VapoRub, so I really identified with that.
And my parents, especially my dad, used something. Do you remember mentholatum?
Oh, yes.
It's very similar to Vicks VapoRub, but it was green. And whenever we had a sore throat, he would say, take a finger swab and stick it actually in your nose, even though the directions said don't do that. But it worked.
Whatever works. Well, we are just thrilled to have in studio with us Taiji Miyagawa, and thank you for your patience. He has to sit through the first segment. He is a third-generation Japanese-American activist and musician. A California native, he comes from a lineage of U.S. citizens who were stripped of their constitutional rights and imprisoned behind barbed wire during World War II for no crime other than being Japanese. With over 4 decades of experience as a grassroots empowerment activist and musician, he has been involved in social justice arenas including housing, healthcare, higher education, labor support work, anti-militarism, and environmental work. Ooh, you've hit the gamut there. He has participated in numerous electoral campaigns from local elections to presidential campaigns, including leadership of voter mobilization efforts at the precinct level. He joins our show today as a proud member of Asian Pacific Islanders for CalCare, API for CalCare, a statewide organization committed to building grassroots power and winning healthcare equality in California and beyond. Welcome, Taiji.
Thank you for having me. Thank you for having us.
Taiji, before you get into the serious stuff, I have one question. What music do you play? What is your instrument?
I play an upright bass, 3/4 upright bass, and I guess it's under the very broad category of jazz, but I prefer to call it improvisational music.
All right. Yeah, I just always wanted to know, so hooray.
Mm-hmm.
Can't wait. So we were interrupted with the news segment, which we started to talk about the disparities in the API community here. So I wondered if you wanted to add anything to that before we jump into why API for CalCare.
Yeah, I mean, it's hard to separate the two. I think, when we were talking about having me come on the show, we talked about getting into big picture issues about strategy and everything like that. And I think for myself, a lot of the ideas I have about that, incomplete as they are, have to do with the effort and the difficulty that we've had out of the various Asian communities to try to push the bar forward in terms of mitigating the problems, as a result of healthcare disparities. And so you had started mentioning about the data with respect to Pacific Islanders, with the COVID-19. And I think it's pretty amazing how we have data now in our hands, such as in California, where Samoans had the highest death rate of all Native Hawaiian and Pacific Islanders subgroups within the state, with 182 deaths per 100,000 people, which is more than double the average of COVID deaths in California.
Wow.
But you don't hear anybody talking about that. That's an extreme piece of data.
We're talking about it here on KPFK.
Only on KPFK and Healthcare for Us, this radio show, are we able to talk about it. And that's why also I would want to express my gratitude to you for not just having API for CalCare on the show, but also others that have been speaking to these important issues. It's really important because of the fact that the media simply doesn't cover this stuff. And a lot of people don't understand that there is implicit censorship, of course, in the corporate media outlets, not KPFK, but in the mainstream broadcast news programming, and even internet searching. If you search for certain topics on the internet, people don't understand that the rankings of those websites are based on ad revenue, similar to programming on commercial television, right? It's like the programming exists to
the bubbles are getting tighter and tighter.
Advertisement in front of you, yeah. Right. So the access to information is very limited, and that's definitely one thing that I know my comrades in API for CalCare wanted to talk about, because the whole notion that Asians are all rich, right? The crazy rich Asian mythology, the model,
which Ronnie Chang was in,
right? The model, exactly, the model minority mythology. A lot of people frame it as something to pit Asian people against blacks and other, oppressed people, but for the Asian and Pacific Islander communities, what's most damaging is it makes invisible the real world problems that we face because of inequalities.
Yes. And, it's when we say API community, it's actually many communities, right?
Yeah, it's in California. The population is at 5.6 million, so it's the most populous state in terms of Asian Pacific Islanders, and it makes sense. We share the same waters, the Pacific Ocean, from where people come from, right? There's 23 distinct Asian ethnic groups and 19 distinct Native Hawaiian and Pacific Islander groups. So it's a very broad term, and it's like I'll be the first one to tell you, even we don't really know ourselves that well, because there's various stages of immigration over many years since the mid 1800s. There are the same amount of languages, actually more, because even within a subcategory of Chinese, there's like many multiple dialects. Amongst Filipinos, there are many multiple dialects. So it's a much more complicated term than a lot of people would lead you to believe.
It does such a huge disservice to, as much as we need to collate, we also need to understand that these are distinct cultures and distinct people that have distinct needs.
All right.
Which is one of the things in CalCare that is so unique and impressive, is that there's a cultural sensitivity component that demands, really, that people's health needs be addressed with culturally competent care. And
in fact, this is the first single payer bill to have cultural competency.
That's right.
In the bill.
And you were involved in a huge fight, right, over culturally competent Sakura Gardens, correct?
Yeah, Sakura Gardens in Boyle Heights was a facility of 3 campuses that Japanese Americans had developed out of their own, sacrifice from my parents' generation, including like people mortgaging their own houses to invest in these properties. And the nonprofit that was leading those facilities decided they didn't want to stay in it anymore. And the Attorney General at the time, Kamala Harris, actually brokered a deal to sell it to an East Indian international real estate developer, right? Oh. So that property that was closed down a couple of years ago in Boyle Heights is like the prime real estate in Boyle Heights, like overlooking the river, LA River, with a panoramic view of the downtown skyline. It's worth a lot of money now, right? And we were trying to prevent the closure of that facility, which the current owners wanted to turn into market rate apartment housing, right, for better revenue than what
near the Arts
could bring in. Right. Mm-hmm. So, and half a block down from the Metro Rail, right? So it's part of that whole master plan of redevelopment, gentrification throughout LA. And we took a bill to both houses of the legislature and won the vote there, but it was vetoed at the last minute before summer break by our Governor Newsom. So there's a lot of lessons in that I think we can get back into when we talk about strategy. But yeah, we're very aware of the problems and pitfalls of the electoral arena and our representatives who don't always represent our best interests.
Exactly.
It was in this fight where I believe, first met you, Taiji, when Healthcare for Us participated. And when you talk about overall strategy, I remember you contacting us and saying, look at what happened with this as when forming strategy for single payer. And you can fill in the details, Taiji, but your organization was successful in getting an emergency stay to keep the residents in during COVID, which passed the Assembly and the Senate. And the first thing Governor Newsom did when he was reelected was he, vetoed it.
That's why we can't have life and death needs left up to the vagaries of political playing back and forth. That's why CalCare establishes a public trust fund that cannot be rated for any other purpose. And it really takes our healthcare out of the political arena. But of course, to get there, we have to wade through the political arena. So Taiji, how do you see us going forward? How does the API communities, I should say, want to, work to go forward? And how can we work in solidarity with this effort?
Well, I mean, like we started talking about earlier, one thing is just like learning about what's actually happening, right? Mm-hmm. I mean, people don't understand what the reality of these disparities are. And our communities, mind you, have been fighting from day one. I mean, it's the human nature to fight to survive, right? And this is the case for all communities facing these healthcare disparities. And so there are things like disparities in the insurance rates, right? Like approximately 14% of Asian Americans and 15% Native Hawaiian Pacific Islanders in California don't have any health insurance at all. And there's it at a higher rate of over 10% than whites. In California. And we have to get into why is that the case? I mean, I think that a lot of it has to do with language barriers, right? People don't know how to navigate the system to apply for Medi-Cal or get Medicare if they're older. They don't even know if they exist, if they're a recent immigrant, right? We don't have an infrastructure that gets the information to people. And so I think for specific communities, we have to get into the mud of the details of how these disparities manifest and figure out how we can offset them and mitigate them as much as possible. And this is actually short of winning the big picture reform of CalCare, but I think we need to start acknowledging these things as subsets of the larger fight for CalCare. Right now, it's too separate, and so that's why you don't see a lot of these communities fighting for their survival in the fold of the CalCare campaign, and we need to try to figure out how to change that.
No, because they're having to do language justice, right? They're having to aid their own community members as they come in. To apply for Medi-Cal is very complicated.
Right.
And we also have older populations that are pretty much inner city. So we look at the fight just recently for the hospital to close the hospital down in Chinatown. And this is part of those 100 hospitals that have been closed in the state of California, primarily in areas of greater need with people who are, language limited, who, are Medi-Cal, Medicare, rural and inner city. But it really hits immigrant populations, I think, especially hard.
Right. Yeah. And I think there's this problem within the Medicare-for-all movement, which we're all involved with, where I think there's this kind of idea amongst a lot of the activists that, if we win CalCare, that's going to solve everything. But the problem is when you overlook the specificities of healthcare inequality, you can't figure out how to address them. Like winning CalCare, for example, doesn't automatically address them. It's a lot more complicated than just having the language in the bill. It's how you would actually implement that change. For example, in this room, we want to support bilingual, bicultural, healthcare. We want to address cultural sensitivities. If we don't have the infrastructure that's training healthcare professionals with those linguistic skills to do that, and nutritionists that understand how to deal with different types of culturally preferred foods to deliver the nutritional value to the patients, it's not that simple.
But CalCare is a job creator.
I was just going to say
beautiful
that.
Jobs.
And a creator of very diverse jobs. Because when you really serve people's needs, there are so many levels on which we are vulnerable and so many levels on which we really need support. And I see this as not just a job creator for health, care related jobs, provider jobs, but so many other aspects of what it is to be human. We need to address all of those.
And it goes into the whole education pipeline too. So it's the whole basic social infrastructure that needs to be recreated. And, the great thing about CalCare is CalCare would provide capital to start doing those things.
That's right. And you're correct. It's not about just passing it. It's about making sure everything gets followed through with. So we have to stick around a little longer than next June when we see CalCare passing. We are coming to you live from inside the studio right here at KPFK 90.7 FM. We are the only radio station bold enough to host programs like this one, Healthcare for Us, so many others that our listeners rely on. But now, more than ever, it is critical to have access to the programming that KPFK has to offer as we see the decimation of public education around us, unraveling rapidly. The phrase Build Back Better has to mean abolishing the for-profit U.S. healthcare industry for the phrase to have any truth in it. But instead of Medicare for all, we're getting the gutting of Medicaid and mass policy murder by doubling down on health capitalism. Only on KPFK will you hear the truth about the state of our world. And the only way we can keep giving you that truth is with your support. We do not take corporate money here. That's why we can actually tell you the truth about our corporate overlords. Each and every time I tune into KPFK, I hear something I've never heard before, truthfully. And for you listening right now, I don't know who you are, in your car, at your computer, listening on your phone, I need you, we need you to pick up the phone and support this station. 818-985-5735, hit number 2. Or if you're on your computer listening, that's going to be real easy for you to open up another browser and go kpfk.org. As a token of our appreciation, we have a fantastic premium for the Healthcare for Us supporters. For a pledge of $150, you can join us in the studio live for a broadcast, and we'll treat you to dinner after the show. And you get to choose your cuisine because this station is located with delicious goodies all around it. Call right now, please, 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 and pledge $150 to KPFK and let us know if you fancy Italian food, Middle Eastern food, Mexican food, or even baked potatoes. That's walking distance as well. Yep, that's all right here and ready for you to be our guest in studio to see how this magic gets made. Folks, right now, we have a bill today of $12,000 that needs to go Southern California Edison, followed by another payment, probably next week, for $3,000. And these are all back fees that we owe from prior years under a payment agreement that went into effect some months ago. We've been doing the best we can to keep up, but a failure to pay that, it's called aged payables, what they're going to do is cut off the electricity to the Mount Wilson Tower.
And we already don't have the AC running.
We don't have, we can attest to how much electricity we've cut down on based on how little clothing we wear to the studio now because it's hot.
Good thing
hot.
this is just audio.
Yeah,
that's all I have to say.
So don't hesitate, folks. I'm telling you, please call KPFK right now, 818-985-5735. Press number 2. Make your pledge to support the station that brings you quality programming like this. And remember, when you make your pledge, let them know how much you love Healthcare for Us. Thursdays is a whole lot better between our show and our sister show, Body Politics. So I hope everyone's tuning in every Thursday at 5 p.m. 818-985-5735, or for those of you on the computer, kpfk.org.
Smiling faces sometimes pretend to be your friend. Smiling faces show no traces of the evil that lurks within. Smiling faces, sometimes they don't tell the truth. Smiling faces tell lies, and I got proof. Oh Lord, yeah.
Let me tell you, the truth is in my eyes, 'cause the eyes don't lie. Amen.
Remember, a smile is just a frown turned upside down, my friend. So hear me when I'm saying, smiling faces sometimes, hey, they don't tell the truth. Smiling faces tell lies, and I got proof.
Beware of the handshake that hides a snake.
I'm telling you, beware of the pat on the back. It just might hold you back. Jealousy, misery, envy. I tell you, you can't see behind smiling faces sometimes. Hey, they don't tell the truth.
Welcome back. That was Smiling Faces Sometimes by The Undisputed Truth. And in full disclosure, our guest today, Taiji, picked the song.
Well, I think it's appropriate just in terms of some of the people that are running some games behind the scene with our legislative efforts in California. We have this insidious bill that's being promoted. Originally, they keep changing their tune depending on the public pressure going up against it. But we have this bill called SB 770 that is being promoted by basic operatives for the healthcare insurance for-profit industry.
Say that.
And
Say it.
I'm just going to say it straight up. You know, you don't need to come up with a new term called united financing if you believe in single payer in actuality. Single payer is single payer. We don't need some other convoluted term called unified financing.
And the name of that bill is what? The number?
SB 770, currently where it should stay in suspension in the Assembly Appropriations Committee. Single payer is all about patients and healthcare professionals benefiting from the public fund without intermediaries.
Mm-hmm.
Unified financing is a multi-payer concept where private insurers charge premiums and raid the public fund to deny patient care for the purpose of making
like
private
Medicare
profit.
Disadvantage, like
Medicare
Medi-Cal in
Disadvantage,
California.
that's
now.
right. So
big
this
clue, people.
So this idea of certain elements in our political structure, paid operatives mostly, certain sellout trade union bureaucrats and other people on the payroll, they use a lot of subterfuge and lies to present these bills as if they're in the public interest. Right?
They're straight out calling it single payer. They're luring people saying, we are single payer stalwarts. What is wrong with everybody?
Well, the Progressive Caucus just had a forum, and one of the spokesperson supporting SB 770 is from an organization called Courage Campaign, and on their website it says SB 770 is single payer. And I just want to say this: if it keeps the health insurance company in, it's not single payer.
It's not single payer.
Single payer abolishes health insurance companies.
Mm-hmm.
So 770 keeps insurance companies in play. That's not single payer. That is false advertising.
Many Asian Pacific Islanders for CalCare were on that call a couple of Mondays ago, and I thought it was pretty disingenuous that the supporters of SB 70 who tried to orchestrate a false diversity behind that bill some months ago, and I think people here know what some of that campaign was about. But they were basically trying to co-opt the credibility of many Asian organizations in Southern California without those organizations really knowing what they might have been voting on, right? And I thought it was interesting how API for CalCare members were very visibly present at the Assembly Health Committee hearing about a month and a half ago in late June. And you saw the other side lining up in support of SB 770 with their public testimony. It was very, very white. It was very stark white to see the contrast between the group against SB 7070 that was very diverse, representing the reality of the California population, and the other side, which were mostly paid professionals, right, and very, very white. So I thought it was pretty disingenuous that they presented an Asian person from the Courage Campaign, I'll just say it straight up, who clearly didn't know anything about the bill. I'm not even sure she'd read it. She tried to infer that SB 770 was explicitly addressing healthcare inequality, which is just not true. If you read the bill, there's one section in there, 1,000 whatever, I can't remember what the point of the bill is, and it kind of has this mishmash about how unified financing is going to address healthcare disparities. There's no meat on the bones in that bill addressing that.
It's not a policy bill.
But in fact, if you are advocating the maintenance of private for-profit interests in the public funding pipeline, that is precisely why we have healthcare disparities. It is not profitable from these companies, for example, to implement bilingual, bicultural healthcare. It is not profitable for them to bring Japanese or Asian foods into the cafeteria. They'd rather get a bulk purchasing deal with somebody that sells frozen hamburgers, for example. It's just not in the mix of the for-profit interest to have cultural diversity, culturally specific healthcare. So it's completely contradictory to what we need. And for the fact that CalCare explicitly addresses how to address this thing, and all the way up to and including capital and investment for facilities, and not to mention administration of addressing these disparities is significant. And this bill, SB 770, has nothing to do with moving us in that
direction. And guess what? She wasn't the only one who didn't read the bill. We had co-authors of the bill tell us they didn't read the bill.
And it's not just the organizations who were misled by the sponsors of this bill, it's legislators. There's a local assembly member, I'm not going to mention his name, but who was at some function with, somebody from the California Nurses Association, an employee in government relations, and he ran up to her excited and said, "I just signed your bill." She said, "That's not our bill."
Right.
Now, with all due respect, legislators, you should read your bill, and anything about single payer, check with the California Nurses Association, because they've been leading the fight for single payer forever.
But this is why the PR man said this is a CalCare complimentary bill.
Right. They were intentionally
he found
misled.
some tweet somewhere that Osh liked of Wieners and were able to tell people this is a piece of CalCare. This is going to forward CalCare, and it's going to do anything but. It's going to derail CalCare.
Don't believe PR men.
And smiling faces, right? Smiling faces. That sometimes they don't tell the truth. Yeah. Well, and this is overall, I think it's really a failure of people in leadership to be responsible, to have integrity, to actually think about what they're doing, to research what they're doing, to make those decisions. And it's also extremely irresponsible of people in these organizations. I mean, we had to leave Healthcare for Us, had to leave Healthcare for All, California, for exactly that reason. So, Taiji, what can you tell us? Where do you think we should go with this?
Well, I think one thing that I feel we really need to do is take a step back from our work. We get caught up in this busybody stuff all the time. And this is not just for the healthcare fight. It's for the housing fight, for criminal justice fight, for environmental justice. The activists are so passionate about of changing things for the better, because we see so many things that are just so outrageous. But I think we need to be able to take the time off. If it's just 2 hours, just tell yourself, I need to take 2 hours, better yet 4 hours or a day, with myself and my friends, other people that are activists in the movement, and think about the big picture instead of just, we have to get to this next event. We have to do this. We have to do that. Right? And we need to start changing the way that we look at things in the big picture, because it's all about building power. If we don't build enough power to deal with something like a governor veto, even though we won the Senate in the Assembly, what's the point? And that's certainly going to be the case for CalCare. A lot of these Democrats, they'll vote yes for your bill, knowing that it's going to be vetoed later. We need to figure out how to build power to deal with that.
All right. At the risk of busyness and urgency, we do have some actions.
And we do look forward to working with you, Taiji, and API for CalCare.
Definitely.
All right.
Thank you.
Yeah, we're so excited to have another organization jumping into the fight with us. And those are great words about taking a beat for yourself every day. And I hope all the activists listening will take heed of that. And if folks need more explanation than we're giving on this show right now, we have a webinar coming for you this Saturday, August 12th at 5 p.m. We're doing an educational deep dive with longtime single-payer policy expert and health policy lawyer Kip Sullivan, examining CalCare and comparing to other bills out there that are calling themselves single-payer but are not. Also on August 22nd, because we always do comedy on this show, we're actually having a comedy fundraiser. And our headliner is Hannah Einbinder of the very funny show Hacks. We've got a great list of comedians lined up. Laura Kilmartin and John Schnitzer, who was on the show with us last time, is hosting. So please go to our website, sign up for this webinar, buy tickets to our night of comedy on August 22nd. Our website is HC4US.org. There you can find all our social handles, what we've been up to. Taiji helps us with our website sometimes too.
And our graphics.
Yes. Yes, thank you.
Speaking of thank yous, thank you so much, Taiji, for being on our show today. We're definitely going to have you back because this conversation needs to be continued. Big thanks to talking about Smiley T for our theme song. Wherever you are, Smiley. Thank you to our tech producer, DJ Scott Peak of the Booty Corns. And of course, D'Angelo Jones is our smoothboard operator. And big thanks to the entire Healthcare for Us team. We couldn't do it without you. Next Thursday is our sister show, Body Politics, a show you absolutely don't want to miss. Our show, Healthcare for Us, will be back the following Thursday, August 24th, same time, 5 p.m. And next up is Rebel Alliance News, so stay tuned for that on KPFK. And remember, single payer is the solution. So
join the healthcare revolution.
You know I like it. I love it too. Single payer healthcare is coming through. I said I like it. I love it too. 'Cause we're all covered. Yes, me and you. Oh, I like it.
Hello, KPFK community. Thanks so much for joining us this evening. Gina, Erica, our fabulous guest, Taiji Miyagawa of Asian Pacific Islanders for CalCare, and myself, Maureen, here with Healthcare for Us on listener-sponsored Pacifica radio station, KPFK 90.7 FM. As we've been telling you, KPFK is a community station funded exclusively by us all. You, the listener, are the key to continuing corporate-free radio. Our show and KPFK both need some love and some appreciation from y'all. Please support KPFK right now by going online to kpfk.org/donate. Mention Healthcare for Us in the comment box or call right now 818-985-5735 and press 2. If you're not an online donor and you're not calling in, you can mail your contribution to KPFK, P.O. Box 748-419, LA 90074-8419. In these times, when there are so many ugly attacks on the rights and well-being of our friends, families, and communities, we need now more than ever honest, straightforward conversation about what is actually happening on the ground, whether it be reproductive and LGBTQ rights, structural racism, labor strikes, outrageous local police budgets, or issues of housing, immigration, environment, the out-of-control carceral system, or the decimation of our public services. KPFK lends a voice to all of these issues important for our survival. KPFK gives us a home. It gives us a home for our Healthcare for Us focus on the disgraceful corporate health insurance exploitation of us all, the inequity of a racially tinged pay-to-play system, limited access to needed care, and the hospital billing scams and the pharma industry extortion. All of these leave people hostage to medical debt, unable to get needed care, facing unnecessary suffering and disability, bankruptcy, and even preventable death. Please donate now to KPFK to keep it alive and thriving. You heard earlier that we've got bills to pay. We need to keep the lights on. We need to keep the mics running. And you, the listener, are the key to continuing corporate-free radio with a variety of news, fact, and opinion you will not hear anywhere else. We need your support now more than ever. Please contribute to KPFK right now by going online to kpfk.org/donate. Mention Healthcare for Us in the comment box or give us a call now, 818-985-5735, and press number 2. Like so many KPFK programs, our Healthcare for Us show exposes and highlights the controversies roiling the activist healthcare justice communities. Make no mistake about it, the trillion-dollar insurance industry is working from within to sabotage healthcare reform that will remove their parasitical, dangerous, and deadly control over our lives. The Dr. Reverend Martin Luther King Jr. said, "Nothing in the world is more dangerous than sincere ignorance and conscientious stupidity." KPFK helps to prevent sincere ignorance and conscientious stupidity by supporting open discussion among people of goodwill who want more information to better understand issues. KPFK gives us all that opportunity to be people of goodwill who have a deeper understanding of so many problems facing us today and the possible solutions for a better tomorrow. So please call now, kpfk.org/donate. Or call now, 818-985-5735, and press number 2. Healthcare for Us, together, Everybody in, nobody out. Good night. Oh, stay tuned for Rebel Alliance news.
KPFK is turning 64, but we're still young at heart and still committed to keeping fresh the Pacifica mission of identifying the causes of racial, religious, political, and philosophical conflicts and to creating peace and justice. As we turn 64, we continue to turn to you to keep us strong and thriving. Become a sustaining member today at kpfk.org and subscribe with a regular monthly donation. Or perhaps you can make a $64 donation. Or contact 64 friends to let them know about KPFK to help us amplify the voices of the peacemakers and freedom riders of today and tomorrow.